I think it's important that we bust the myths that are clearly in the interest of the commercial sector to promote protons as something, as a complete replacement for radiotherapy. I mean, there are huge uncertainties in protons, and much as I'm very much an advocate in the right place, the quality assurance has to be fanatical, because there are all kinds of uncertainties in terms of where does the dose go. It's very susceptible to range uncertainty because of movement, difference in density within the body. It's got some biological quirks which we actually don't fully understand yet. So a lot of the habit that we've got into and a lot of the evidence base of shorter fractionation schemes combination with photons, combination with drugs, is totally uncertain, and there may be some real dangers there with protons. So it's an area where the biological effectiveness comes in, because it isn't a uniform dose distribution across the classical Bragg peak, which means that we've already got evidence in some pediatric brain tumours that there are white matter changes that are not explicable just by dose. So though protons are something slightly different. So real caution, and if we don't do it under proper evaluation in an academic framework, I think there are real risks. So that's why the NHS is doing it within the spectrum of major academic clinical oncologists, clinical cancer centres, integrated care, so we've got the highly specialist surgery and MDTs all in the same place. And I think that's the safe way to do it. I think pretending that this is just IMRT, but just give it with protons, is completely a false premise and potentially very dangerous and worrying.